This conference will now be recorded.
Ladies and gentlemen, Dr. Ryan here, coming at you sort of live, bringing you another episode of From the Desk of the Dr. Ryan Livingston. All right, ladies and gentlemen, start over.
This conference will now be recorded.
All right, so today what we're going to bring to you is an amazing concept called Spinal Hygiene for Life, baby. How to get a proper, healthy spinal curvature for life. That is the most important thing that I can teach you as a doctor, is to take care of your own spine and posture. How do we do that? Great question. I created an awesome document called 7 Steps to a Healthy Spine for Life, or something along those lines. You can download it for free on the website once it's up and running and live. Until then, just message me. We will have our team get it out to you as soon as possible. The first and most important step is to, of course, have an awareness that a healthy spine is important for overall function of health and life. Your posture is directly related to your overall health and quality. How is that possible? Because your spine has 2 main functions. Number one, it creates your posture, which you're very familiar with. It's your posture is what supports you and keeps you upright. That is our spinal column, and we call that posture. You've heard that a million times. Number two is that your spine, or what I call your true posture, because from an external surface, we can see that, let's say your shoulder's higher than one shoulder's higher than another, right? Like this. That would be your posture. But what your true posture is when you look like this is what your spine looks like when I take that picture, because it can look like a ton of different things. You could have a bend in the mid back that causes you to look like this. You could have a bend in the low back that causes you to bend to this direction, scoliosis. If it's from the side, you could have forward head posture, but your curve could just be completely straight and bent forward at the mid back, or your curve could be completely reversed and forward head posture. You don't know until you take advanced imaging to see exactly what your x-rays look like, exactly what your true posture or your spine itself looks like. Also, what you don't know is where you need to fix it, how you need to address it. Can you fix it? Is there degeneration? Is there tantamount degeneration to the degree that we can't even have an effect on it? If you're very, very, very old, that may be the case. More often than not, it is not the case. More often than not, 9 times out of 10, more than 9 out of 10 times, we can fix it, or at the very least, get really good correction in the spine to help you facilitate an overall healthy posture for life. And that means a healthy spine as we fix it. So that posture is directly related to your overall health, because the second thing that your spine does is it controls and coordinates every single cell, tissue, and organ in your body. How does it do that? The brain turns into the brain stem, which comes down your spinal column and turns into the spinal cord, which goes all the way down your body, all the way to your butt bone. Okay, and then it turns into the cauda equina, or a group of nerves that stem out at the bottom. These things at the very bottom are responsible for bowel bladder function. You may have heard of a severe injury, a spinal cord injury, where they say, hey, if you lose bowel and bladder function, you need to go to the emergency room. Why? Because you might have cauda equina syndrome. Those same nerves, or the group of nerves around that same area in the low back, are responsible for sciatic radiculopathy, or just sciatica, which you've heard of before. You've heard of neuropathy. Most people have heard of neuropathy before. Most common cause isn't even diabetic neuropathy. It's neuropathy caused by a rotation in the pelvis, or a loss of curvature, or too much curvature in the low back, causing compression and dysfunction on either side of the spine in that low back, where those nerves come out and then send strength and energy down the legs, into the knees, ankles, feet, and also into bowel and bladder, reproductive organs, which also causes things like erectile dysfunction. So that's having awareness. Number one of the 7 steps to the healthy spine is having an awareness that your spine even controls and coordinates all those functions in your body. So having an awareness that is extremely important to overall function, health, and quality of life. Now you know. Second step is to analyze that, which I just kind of discussed. Is having advanced imaging to truly see, what does your spine look like? Are there twists and kinks in that spine? Is there damage and degeneration on one side, which indicates it's been there a long time? It will help us know how long it's going to take to correct it. And it also might point out exactly which part of the nerve tissue or the body is being compressed and has a dysfunction on it. Is it the actual nerve itself? Is it so close to the nerve, but it's not actually compressing the nerve? And therefore, you may only feel the symptoms when it's inflamed and irritated. But until that point, you may have organ dysfunction, which you're not aware of. Okay, so you got to analyze it. Step 2 is analyzing the spine, which means advanced imaging. If you're not having imaging of your spine, you don't know what it looks like, you don't know how to correct it, you don't know how long it's going to take to correct, and you don't really know where the dysfunction is coming from. Number 3 is you want to correct it once you analyze it. That takes a corrective care doctor, such as myself. There are a few doctors that are not doctors of chiropractic that can do that, but they are few and far between. The primary one would be a doctor of chiropractic who does undergo advanced training, advanced postdoctoral training on analyzing the spine and analyzing how to correct it, which takes quite a bit of care and is published in the medical literature. And we like to follow those protocols, which are the same protocols that or the same analyses that the spinal surgeons may utilize to determine if you are a candidate for surgery and what type, whether it's a disc or it's a fusion, whether it may be a PM&R physician, which is just a special acronym for a pain type physician who might do an injection into your back, which we don't usually advise more often than not. Sometimes we do, and we work a lot with those types of physicians as well. Number 4 step, 3 is correct. 4 is stabilize. As you go through the corrective care process, you've got to learn to stabilize it. You may start to get correction, but if you just fall off the wheel and quit care and quit on yourself in the middle of care, you might get to the point where your ligaments start to correct, but they're not quite yet stabilized, and I'll call it like sutured or cemented in, which takes an amount of time and home care and exercise and repetition, which we'll go through in way more detail at another date. But if you don't stabilize it, you won't achieve that good, we'll call it permanency to the structure, which is what you're shooting and what you're after. Because then once you stabilize it, then we can teach and educate you on how often you're going to need continual adjustments for life, why that's important, why that investment is so important, what does that proactive or the active to wellness care look like, and what is your consistency. If you're an elite athlete who's constantly under the bar, doing CrossFit training, trying to go to the games, and you're continually wearing and tearing on your spine, putting under advanced loads, you're going to need way more care than somebody who's barely active, but just enough to be somewhat healthy. Number 5 is optimizing that spine, which we teach and educate you on. I just briefly discussed, which is once you stabilize it, once you correct it and stabilize it, then you've got to stay on top of it. Because once I help you achieve that structural correction, which is the key to long-term permanent health, what's my job? Just like a dentist, my job is to keep you on top of that and keep your teeth healthy, or flossing your teeth, brushing your teeth. I got to keep you flossing your spine, which means hands-on adjustments, using arthrostim, using machinery, using my hands to keep those joints moving and articulating healthfully through their full range of motion. That's my job. So that's optimizing. And at that point, you're starting to see really crazy, awesome improvements in care and function. Things like you've been under a year or more of care, and now you really don't even have a medicine cabinet anymore. You're either completely off most of your medications, or you've dramatically reduced them. We work with your PCP or help find you a good one who's got the goal of getting you off of medications that you don't need to be on. So that's the optimization care. Number 6 is hygiene, having a hygiene for life. And we teach and educate you on spinal hygiene, what to do once your spine is back in its normal healthy alignment, or as close to possible, or as close as is possible for you. If your spine is really degenerated in one region, we may not get that structure back in that specific area, but we got to keep the areas around it and it moving appropriately so that it stays healthy and doesn't degenerate. Such as if you've had a surgery, let's say it's L4, L5, you got to keep L5, S1 and L3, L4, the areas just above and below your fusion, moving properly so that you don't get advanced spinal disease or ASD, advanced segment disease, okay, or degeneration, which means that those segments above and below where you had diffusion start to degenerate, wear and tear faster because they're becoming hypermobile, okay? Then number 7, oh, that also includes giving you a spinal hygiene kit, which I give all my patients that undergo a series of corrective care. That's wobble discs, things like the wobble discs, rehabilitative exercises if you need to continue to do them throughout your stabilization and maybe even into optimization care. If it takes you a little bit longer to correct, you may also do spinal hygiene that involves cervical distraction, things of that nature. They might even be wall straps. I'm looking over here because I have one on my wall or on my door as a Stroops kit where you can do exercises off of the Stroops band that wraps around your door. Freaking amazing, extremely inexpensive, less than $100 for a full workup, for a full decked out kit, or somewhere around there, somewhere around $100, $150, maybe even $200 if you want to get really fancy schmancy. But that's nothing of an investment. That's less than a gym membership. Number 7, as the 7th step to a healthy spine, is sharing and caring. Not caring, but caring. The reason that's so important is you want to have the mindset of health and contribution. When you are going out to a restaurant that you freaking love, you refer people to that restaurant, no hesitation, right? Or when you, let's say, um, see an awesome movie and you're like, oh my God, The Avengers, it was so amazing, you got to go see it. You tell everyone about it. For whatever reason, in healthcare, we don't tell people when we experience an amazing doctor, really, right? Like it's don't feel bad. It's just not something we commonly do. But as for myself, especially a doctor of chiropractic, it's extremely critical that you tell people about it, especially because this industry, but also this paradigm of health just is discussed. People don't know you don't need asthma inhalers and medications for asthma for the rest of your life. I'm one of those perfect examples, and I have seen thousands of patients that have gotten off their inhalers completely for life so far. Why? Because they fix their spine, their body starts to heal itself and repair itself, including things like getting out off of dairy or any inflammatory / mucus forming foods that uh, don't tolerate or are not tolerated well by their body. So spreading and sharing the message. I've had several patients, hundreds of patients actually, several of which have had migraines as long as over a decade. I've had several that have been over 15 years. They come and get adjusted, just a few adjustments, and their spine's not fixed after just a few adjustments, but the symptomatic relief is there. The first time in over 15 years that they got relief from a migraine. How freaking crazy is that? And they didn't even know about it. So imagine all your friends that are having migraine headaches or having acid reflux that don't realize that fixing the spine and getting the body back to healing itself will help with that. AKA getting adjusted in chiropractic care can help with that if the issue is coming from the spine, which many of the times it is. It's not a deficiency of Tums that is causing your acid reflux. Does that make sense? So many conditions. One of my favorite is the one that's never talked about, especially in elderly, is erectile dysfunction or reproductive issues, sexual reproductive issues. It's really funny because it will be the wife or the husband that comes in and says like, hey, and so far it's been like on the hush hush without their partner in the room. They'll ask me, hey, does this help with erectile dysfunction? Because I've noticed I've been lasting longer. I'm actually able to perform in bed now. Is this something to do with it? And I'll be like, absolutely. Remember when I was explaining, you came in with sciatica or you came in with neuropathy into the legs, numbness and tingling. And we only knew that it was coming from the spine because we did an extensive exam, a neurological exam, and we did the monofilaments, tested the fact that you're losing sensation in your legs in addition to having the pain. That starts to go away. Reproductive health starts to come back. Freaking crazy, right? And those patients tell people, right? So it's things like that that you want to grow and contribute to a society. It starts to raise healthy children, because it's easier to do that than fix injured adults. And many of us were really sick at once. Then we found out about chiropractic. We started to experience it ourselves, whether we're elite athlete, and we started to feel not only the obvious performance and function and personal records we set after we get adjusted, but the lifelong health. And it's our job to tell people about that, because you just don't hear that message in the mainstream. So the seventh step in a healthy spine for life is the contribution and mindset of health, and it comes from us telling people. So 7 steps to a healthy spine for life. If you don't have a spinal hygiene kit, stop at the website, buy one. We'll send it to you with a one-on-one consult explanation of how to use it. We really like to only do that for patients primarily, but if we can set up a telehealth exam, we will also do that, so we can at least get you to a local doctor that can help you, and uh, then we'll help facilitate and assist you in utilizing spinal hygiene. We also have plenty of videos online that we'll send you that explain and teach how to properly perform these things. But as always, you want to have what we called step 2 in place, which is analyzing your spine. You want to have advanced imaging. Helps a lot. Okay, so that is it. I'm signing off, Dr. Ryan. Um, any questions, please feel free to email me, contact me. Let's make it a great life. Ciao.